So thank you all for joining me today. I think, as you know, on Saturday we passed the 100-day mark from when we had our first case of COVID-19 in Pennsylvania. And back then, back in the early days of this, 100 days ago, my fellow governors and I were facing the monumental task all across the country, deciding the best way to halt a virus that we really knew nothing about. In Pennsylvania, we chose to act swiftly and decisively to eliminate as many public interactions as we could in anticipation of this virus's spread. The idea was to buy time, that we really wanted to make sure that our healthcare system was not overwhelmed. And because we took quick, decisive action, we never actually reached the sky-high new rates that many other states have reached. We never saw ventilator shortages. In fact, I think today we have 5,300 or so ventilators out about in the Commonwealth, of which about 170 are being used for COVID-19 patients. So we never saw ventilator shortages, and our hospitals did not become overburdened. But just like in other states, Pennsylvanians, we're all eager to resume our lives. And I've heard this, and I understand the calls for reopening. I know what it's like to be a business owner worried about survival. I know what it's like to feel cooped up in your home and not being able to go to your favorite restaurant or your favorite store. I know what it's like to miss family. I know what it's like to miss friends. But we also, right here in Pennsylvania, the Commonwealth, we're responsible for the lives of all Pennsylvanians. And so we've tried to balance these things with measured, science-based actions, including when it comes to reopening. Every week we've used data to walk a tightrope between risking lives and being too cautious. And because of the virus's incubation period, we couldn't know immediately how we're doing. We needed to make sure that we were doing this in a time frame that recognized the virus's time. The virus is dictating to all of us. Now we have the data, and we know that our science-based approach has made Pennsylvania actually one of the leading states when it comes to addressing the COVID-19 pandemic. Our new case rate has fallen consistently, even as we've reopened businesses, even as we've resumed activities, even as we've gone back to work. Our new case rate is now about a quarter of what it was at the peak. And the Centers for Disease Control and Prevention says that we are one of just 3 states, along with Hawaii and Montana, that has had a downward trajectory of COVID-19 cases for more than 42 days. According to Johns Hopkins University's Coronavirus Resource Center data, Pennsylvania's steady decline in cases since April is particularly important because it's happened as we've opened more counties. The latest report indicates Pennsylvania is among a handful of states with sustained decline in cases over the past 2 weeks, and that's an important indicator that reopening plans are actually working. We know our decline is real because of the choices we've made, because more than half the states are experiencing just the reverse. I don't know what the count is today, 23 or so states are, 24 actually are having an increase in cases. We're not. We have had, I think, a good experience. We've remained focused on balancing economic interests with public health. And we've done that by relying on science, by relying on evidence. So decisions like allowing businesses to bring employees back, but requiring physical barriers and health screenings, that stuff works. Allowing stores and restaurants to reopen, but requiring Pennsylvanians to wear masks, which has been shown to reduce transmission of COVID-19. We're allowing youth sports to resume, but we're implementing protocols to cut down on touch points. We recognize that this is not an either-or situation. We shouldn't have to, and we don't have to choose between our health and our economy. There's a middle ground that allows us to open businesses while cutting down on the spread of COVID-19. By participating in small actions recommended by the CDC and the Pennsylvania Department of Health, we can continue to break down transmission links even while we resume daily activities. Actually, things like washing hands, that works. Bringing your own water to sports practice, that works. And of course, wearing masks, that works. Recently, more studies have been coming out that showing that mask wearing actually works. This includes a peer-reviewed study published in scientific journals like the New England Journal of Medicine, I guess there are multiple studies. As the U.S. Surgeon General said just a few days ago, wearing a mask does not impinge on our freedom. It gives us more freedom from unknowingly spreading COVID-19 to others. It actually increases their freedom. As I've said, this reopening process is about balancing small choices like wearing a mask with the greater ability to go places and do things that we really want to do during this pandemic. Pennsylvanians have done an excellent job. We all have done an excellent job demonstrating how to balance business and public health. If we keep this up, we can continue to be a model to other states, and we can continue to be a leader at saving lives and livelihoods during this pandemic. So thank you very much, and thank you to Pennsylvanians. And now I'll turn it over to Dr. Levine.
Thanks, sir. Good afternoon. Thank you very much, Governor. As the Governor has been saying, wearing a mask is a relatively easy but very effective way to help prevent the further spread of COVID-19. It is really essential and required that employees in businesses and in stores, etc., wear masks, and that the customers wear masks. And by having the whole community wearing masks, we protect the community from this spread of this very contagious respiratory virus. The Governor had mentioned that there are new studies emphasizing the effectiveness of mask wearing in terms of protecting communities. There's another important way, though, that people can help. We know that of the nearly 80,000 Pennsylvanians who have had COVID-19, approximately now 75% have recovered. I am encouraging Pennsylvanians who have had COVID-19 and fully recovered to donate plasma. Because you have recovered, your plasma now contains COVID-19 antibodies. These antibodies actually helped your immune system recover when you were sick with COVID-19. And those antibodies could help someone now who is battling the virus as we speak. If we see the potential anticipated resurgence of COVID-19 in the fall and winter, then your plasma may help many more people in their recovery. In addition, if you have not had the virus, COVID-19, then blood, platelet, and plasma donations are still urgently needed to treat people with other serious medical conditions. The American Red Cross is testing all blood of donations for COVID-19 antibodies. You can call 1-800-RED-CROSS, or in other words, 1-800-733-2767 to find a blood drive near you. Please remember, if you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Program's Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. And what is most important for Pennsylvanians to remember is stay calm, stay alert, and stay safe.